My name is Aaron Gerds, and I'm the editor-in-chief of ASH Clinical News. Welcome to this month's From the Desk of. Hematologists are no stranger to change. Every time a new drug gets approved, a new set of guidelines come out, or even a new diagnostic classification system is published, we have to change what we're doing every day in our clinics and in our practices. But sometimes there are changes that come about for other reasons. And the recent Dobbs decision by the United States Supreme Court is no different. On face value, you might say, well, this is only for women's health, reproductive health, obstetricians, maybe even primary care docs. How does this affect hematologists? Well, it definitely can affect hematologists on a lot of different levels, and I would argue that hematologists are on the forefront of the changes that come about via this decision. With the overturning of Roe, we think about patients who are faced with the awful situation of where they have a life-threatening cancer but may be pregnant. And how do you balance the pros and cons of the different things that can be done in that situation? We know that access to reproductive health is incredibly important for us as a community as well, us as a community of hematologists and people who take care of patients with hematologic disorders. And that can adversely affect our workforce. So, it is really an important decision that came down and something we have to be very thoughtful of because, again, it can affect hematology so deeply from so many different angles. And so we've taken our feature article this month to really try to dig through all these different ways this decision impacts hematology and the practice of caring for patients with blood disorders. Also in this month's edition, we have a wonderful You Make the Call with a response from Dr. Ayalu Teferi, kind of looking at the subtle points of to treat or not to treat in essential thrombocythemia. We have a full slate of literature scan and news items coverage, as well as this month we're launching our special online-only content. So extra coverage of the published literature in blood and blood advances, as well as the rest of the hematology literature. So look for that coming to your email inbox soon. Well, that's all for this month's From the Desk of. Until next time, keep the blood pumping.